for the program. And that's what often drove treatment. So what happens nowadays is you better have a darn good reason and plan for what you're going to do with somebody while they're in treatment. That means lots of documentation and lots of strategy and lots of kind of science-based counseling on why somebody needs the care they're going to get, because insurance companies and managed care companies don't want to pay for it. So many rehabs across the country closed. When I worked for Conifer Park was a for-profit rehab. And while I was there, they built, I don't know, 3 or 4 more rehabs throughout the country, usually in kind of almost like vacation settings with swimming pools and saunas and great dinners. At Conifer Park, when I was there in the 80s, they had a lobster and steak night once a month for the patients. And the idea was, if you're an addict, you're a person that needs to get well, not a bad person that needs to get good. So it was big business and big profit, because you didn't have to pay a team of doctors or psychiatrists or surgeons. You paid people like me and you. And at the time, I remember my salary, which I thought was a lot at the time, was $17,000 at Conifer Park as a counselor. And I was a provider of care. There was one medical doctor, there was a consulting psychiatrist, and there were 3 or 4 psychologists. So they made money until managed care came along. And then the whole model for care had to change. Not just at Conifer Park, but all over the country. So today, treatment is much different than it was in the 80s and continues to be. So there's people with insurance, there's people with no insurance, and there's people with Medicaid. And so what's the difference? Well, probably shouldn't be any difference, but there certainly is. If you have Medicaid benefits, there's plenty of treatment alternatives. In fact, right now, Conifer Park takes Medicaid, I believe, and St. Peter's and very nice rehabs. If you don't have any insurance, if you're kind of what they call the working poor, then you have to work out a payment plan. And it's often the case that your number of days in treatment will be less. Or there's what's called therapeutic communities. Therapeutic communities are a 60s drug treatment kind of model, where the idea was kind of the opposite of addiction treatment now. It used to be the case that the alcohol treatment model was called the Minnesota model, because that's where rehab started, the rehabs we know about today. And that was 30-day treatment, and you got education, you got counseling, you got introduced to the 12-step programs, and you were seen as a sick person that needed to get well. If you found your way into treatment, say in New York, because you got busted for selling heroin, you wound up in a therapeutic community as an alternative to going to prison. Or you didn't have benefits, or that's where you wound up. And these were programs that went from maybe 9 months to 18 months, usually in an inner city, and had names like Hope House, Hospitality House, Daytop, or some of the more famous ones. And their theory was kind of, you had to tear a person down before you built them back up. And so therapeutic communities were more boot camp-like, where people got yelled at and people had restrictions and people had their head shaved, and if you misbehaved, you might have to wear an embarrassing sign around your neck, or a group of other residents would meet and yell and scream at you, and that was supposed to shock you and tear you down and build you back up. Does it work? Did it work? Well, like some of the videos we've watched, a third, if you look at a percentage of people, a third of people will get better on their own, a third of people will never get better, and a third of people might get better with addiction or with treatment. I don't know if those are the right statistics or not, but we don't have real good science on what works and what doesn't work. There are some studies to say that people who quit on their own are at least as successful as people who quit with rehab. So I don't know what that says about our field, except we need to get better at studying our field and using techniques that are scientifically proven. So oddly enough, the therapeutic communities didn't used to follow the disease concept. So whereas in an alcohol rehab you were told not to use any substances and never ever to drink, back in the old days in the therapeutic community, your problem wasn't physical, it was your personality. And oftentimes when you graduated, they would have a keg party with beer from some programs. So kind of odd. And there's people who graduated from programs like that who now work in the field. And that's how they came to recovery. So our field historically has a lot of twists and turns and changes that are sometimes odd. But it's good to know the history. If you want to get a job in the field, you don't need to be certified or credentialed. It certainly helps. But if you're starting out and you want to work in the addiction field, look at the programs that run 24 hours a day because they need the most staffing and they often have the least desirable positions. But sometimes if you want to enter the field, you can start at overnight and then move to evenings and then move to days and move from assistant counselors to counseling jobs. Outpatient work is nice because you get weekends off and holidays off, and clients do their misbehaving at home. If you work in a rehab or a therapeutic community, people act out under your watchful eye, and you have to deal with it. So that can be more exciting work. So if you're looking for a position, think of places that are open 24 hours a day. Look in the nonprofit sector because they'll have worse pay at first, and continue your education. Now there's a tiered system within the CASAC model. There's CAC 1, 2, and 3. And for instance, like I'm almost a level 3. I have one more course I have to take that isn't offered very often. But I have a master's degree and I've been a CASAC since 1986. So I can be a level 3 if I ever get to take the Clinical Supervision 2 course, which isn't offered very often. So there it is. There's the field. And probably raised more questions than I answered, but I thought that might be a good introduction. Let me know what you think. Thanks.